Hello, I'm Cemal Ozemek. I'm the current president of the Clinical Exercise Physiology Association, and I'm virtually joined here by Laura Richardson, who is the immediate past president of CEPA. We're very excited to be giving this virtual town hall series. This is a recording of the first part of this town hall, where we're going to review updates to current professionalization efforts that are being made by CEPA, as well as ACSM's Reimbursement Task Force, and then provide an update on contributions that CEPA has been making within the field and discuss upcoming events and projects. For today, I'd like to start off with just discussing general professional and educational barriers that we currently face as clinical exercise physiologists. Then we'll get into a discussion of what professionalization efforts are looking like, in addition to ongoing efforts towards achieving reimbursement for our clinical services. And then we'll finish up with ACSM and CEPA current and future activities. Now, when we think of the clinical exercise physiologist within the healthcare setting, we face a number of challenges. For clinical exercise physiologists, we are regularly working in cardiac, pulmonary rehab, and exercise testing services, which are reimbursed. Next to us, we have qualified healthcare professionals, such as nurses, physicians, physical therapists that are providing their own services. But when you're comparing the two groups here, what we see is that the clinical exercise physiologist is essentially in a bubble. We can only practice in services that are reimbursed, not necessarily because we are clinical exercise physiologists, but the service itself is being reimbursed. This presents a challenge because other qualified healthcare professionals, while being able to work in their own setting, deliver their own services, can also be a part of cardiac, pulmonary rehab, and exercise testing, and potentially compete for positions that a clinical exercise physiologist is more than prepared to deliver. Another barrier is recognition. When we're thinking again of just the general health field, we have a number of QHPs, or qualified healthcare professionals, that again are providing very identifiable services. So the patients know exactly which practitioner that they would need to work with to be able to treat any one of their ailments or conditions. These QHPs also know exactly who to refer to or who to identify to gain additional services for their patients. Unfortunately, the clinical exercise physiologist, or the CEP, is not included in this circle. And this is something that we hope to change through our professionalization efforts. Now, what are the contributing reasons to this? While there are many, one potential limitation could be the way in which clinical exercise physiologists go through their training and eventually prepare for their careers. It's not as well delineated as when we compare physicians, nurses, physical therapists, dietitians, and dentists, for example, and how they go through their training. For each one of these professionals, they would be accepted into an accredited program. They would complete rigorous coursework in addition to clinical rotations, pass a board or licensure exam in order to be designated as a qualified healthcare professional and be able to enter into the healthcare system and potentially bill for their services. Well, we're talking a lot about qualified healthcare professionals and QHPs, but what would constitute a QHP? What is required? So these are individuals that have the standardized education, training, they have professional regulation, and in some instances, they may need facility privileging to be able to practice. These individuals also perform a professional service within their scope of practice and independently report that professional service. So this is the foundational elements that are necessary to be recognized as a QHP. As it stands right now, we don't have all of these elements in order. Fortunately, we have a concerted effort by ACSM's Reimbursement Task Force, which Laura will be talking about next.
Thanks so much, Cemal. So as Cemal introduced in the introduction, I serve as the past president, and I am excited to share a little bit about the ACSM task force that has been created, and it serves to review and create a path forward that allows for clinical exercise physiologists and exercise physiologists, so both the CEP and the EPs, to have a direct career path delivering essential clinical services. The task force is chaired by Dr. William Krause, who's a cardiologist and professor of medicine at Duke Health. Again, the goal of the task force is working on the elements to be recognized as QHP, be able to deliver exercise and healthy lifestyle counseling and supervision to patients, and eventually be able to bill and be reimbursed for our services. Cemal and I are going to spend some time discussing this pathway of the QHP. So this is an ongoing process, but we do feel today is the right day to be as transparent and open with the efforts that are currently in place. The four major elements include the importance of programmatic accreditation at the university level, adequate preparation for professional credentialing, certification, support and opportunities for continued learning and competence as professionals, as well as being recognized both domestically and internationally on a professional registry. The first step we want to spend a little time talking about is the COAs. As mentioned, this programmatic accreditation is very important. It serves as a backbone to professional recognition. Aligning academic preparation follows numerous fields such as nursing, social work, physical therapy, all demonstrating that students are uniquely prepared with skill sets and competencies. The Committee on Accreditation for the Exercise Sciences, we know this as COAs, is under the QHP accreditation, and this academic accreditation fuels the readiness for certification. It helps to improve credibility of our profession. The year 2027 is the date that's been set for nationwide programmatic accreditation, enabling all of our students the eligibility to sit for the certification. Continuing competence plays another paramount role in professional development. CEPA provides continuing education credits through our quarterly webinars offered 4 to 6 times yearly. Additionally, CEPA hosts a virtual conference offering CECs featuring innovative topics to help practitioners to stay informed. CEPA is also strategic partners. Oh, there we are, with some international organizations. This international organizations all are helping us to lead our way for advocacy and advancement of our profession. ESSA, Exercise and Sports Science Australia, CSEP, Canadian Society for Exercise Physiology, and BASES, BASES, is the British Association of Sport and Exercise Sciences. All are current partners, and the importance of this is that it provides our CEPA members the eligibility to access continuing education programs at their member rate. So please be sure, if you're looking for continued learning and CECs, to check out the incredible variety of international podcasts and webinars that we offer with ourselves and our strategic partners for professional education. The next key element is professional registry. Having a registry is a very vital piece to the advancement of the CEP. With growing attention placed on our profession for qualification standards, the establishment of the registry serves to define and recognize qualifications. CEPA, which is the Coalition for Registration of Exercise Professionals, has secured registration for all exercise professionals supporting distinctive roles within the medical, health, fitness, and sports performance fields. All exercise professionals who hold approved and recognized credentials, that's us with ACSM-CEP, are NCCA accredited certifications. And what this means is that all are automatically in US Reps registry. So as a CEP, what this means to us is that it serves to recognize our credential. It helps to educate stakeholders and policymakers, both domestically and internationally, and it helps to ensure that the CEP profession is well positioned to be able to work cooperatively with other professions to help broaden career opportunities to those who are qualified. The registry serves to align with other regulated health professionals who are also NCCA accredited, such as registered dietitians, nurse practitioners, medical assistants, occupational therapists. This big piece of the registry, again, serves to help connect physicians, referring healthcare professionals with qualified accredited exercise professionals, helping to improve the access to CEPs. Additionally, within the registry, I want to point out that this provides a standardization in how we are identified with our credentials. It holds a place to help others understand where to search for us and to validate who we are. It gives us consistency across all exercise practitioners. As we know, exercise physiologists have been recognized using many different titles. So using the registry helps to reduce the amount of confusion. As I mentioned, all ACSM credentialed professionals are housed in US reps. As an ACSM-CEP, it's important that our accredited credential is properly displayed to help with recognition and advocacy of the profession. The proper designation for CEPs after your name is to use ACSM-CEP along with a full title written out underneath, Registered Clinical Exercise Physiologist. No longer using the post-nominal letters RCEP. Additionally, as you see here on the screen, the ability to use the hyperlink directly from the US reps again helps to serve as a way to recognize who we are and proudly display our credential within our signature line. So if you have not yet gone to US reps, please take a moment to hop on. The link is below in the description here in the YouTube link. So how do we become part of the reimbursement system? Increased awareness and trust regarding our role in the healthcare team is key. Momentum of these key 4 elements are all underway to be established. The journey to earning QHP follows the pathway of all other qualified healthcare professionals that have become recognized by the American Medical Association. So we need to ask, where does the clinical exercise physiologist sit right now? We are currently delivering hands-on care as uniquely qualified exercise professionals in medical settings, not limited to, but for example, cardiac pulmonary oncology, metabolic clinics. Many are employed in physiologic diagnostic laboratories, including testing, facilitating the understanding of physiology and human disease. But we are not well connected. We are not well recognized. Earning the QHP status does not guarantee reimbursement or inclusion into the referral network. The good news, though, is we are seeing an increased use of CEPs within the presently evolving changes in the healthcare landscape and workforce needs. The road to reimbursement encompasses many different steps. A few additional elements we want to touch on is the importance of obtaining a national provider identification number, which I will talk about in just a moment, helping to increase the awareness and trust regarding our role in a healthcare team, eventually being recognized as a qualified healthcare provider, the ability to obtain CPT codes to provide our services and obtain increased referrals, and eventually to have ICD-10 CM codes through the International Classification of Diseases to help dictate patients the CEP is able to work with and recognize as providers through different providers and insurers. So we want to really focus in on what we can do, as we discussed with the QHP. So according to the AMA, a QHP we know is a healthcare practitioner who has earned accredited education at the university level, possesses an academic and accredited certification, is listed on a professional registry, and completes timely continuing education. We've gone over all of those 4 steps. We are making progress. Where we all today, sitting in listening to this town hall recording, is you can help. So your help as an ACSM-CEP or an ACSM-EP to actively take part in promoting the profession is by earning recognition and obtaining your National Provider Identification Number. This is the NPI. The registration is free and can be completed in just minutes. Following the steps we have here outlined is you first just go to the link. You're going to second create an account and complete the application. And the third step is you've now entered your taxonomy code number. The link and more details is again below in the description here in the YouTube channel. But if we all CEPs and EPs registered for the NPI number, the profession will now have more visibility, and we will have yet removed another barrier of being recognized as a provider. In time, the reimbursement healthcare agencies, healthcare insurance companies, and other healthcare providers who use the NPIs to identify the QHP rendering services to their clients. ACSM-CEPs and EPs can have both an individual NPI and a group NPI for the practice that you are currently working at. Right now, we have only about 4,000 exercise professionals out of about 18,000 credentialed CEPs with an NPI number. So please take a moment again, and you can take a look at the links we have provided below to help you with the steps. It will only take a few moments. So thanks. I'm going to turn it back over to Cemal.
Excellent. Thank you, Laura, for that great review. So just to really reiterate, we are setting ourselves up for success here. If we think back to what Laura outlined as far as kind of the steps needed to be recognized as a QHP, we have programmatic accreditation. We're really pushing for programs to jump on board with that. A huge incentive, as Laura mentioned, with professional certification. Starting 2027, students or individuals who want to sit for the ACSM-CEP exam will have to have graduated from an accredited program. Additionally, we have continuing education, and we have US reps as the registry. So we are certainly in a good position for that. Additionally, when it comes to reimbursement, as Laura had mentioned, we can actually obtain an NPI if we have ACSM-EP or CEP certification. So again, encouraging you all to sit for that. The areas of focus and interest right now, as far as future tasks from the task force, are going to be related to identifying ICD-10 codes, CPT codes, and eventually getting approval from insurers for our services to be reimbursed. A key element to achieving that is our ability to be a part of the AMA's Healthcare Professionals Advisory Committee. Now, this is a committee that is composed of representatives of organizations representing qualified non-physician healthcare professionals. ACSM is leading the charge with this application to be a part of this group, and CEPA is the organization that is representing the Clinical Exercise Physiologists, and because we are an affiliate society of ACSM, whenever we do get a seat with this committee, we are going to be at the table with all these other organizations. And this is going to be critical because this is the committee that essentially recommends CPT codes for various services. So CEPs would have the opportunity to provide recommendations on creating CPT codes for services that CEPs can deliver, and potentially recommend some Category 3 codes. Now, these are codes that are essentially created to collect information on their use as well as the efficacy of the service in improving outcomes for patients and reducing costs for insurers before they become Category 1 CPT codes, where you'd eventually be reimbursed for that. Now, it is key that we get a seat in this. We're currently at a position where we have applied, received initial feedback from the committee. Our leaders within the task force and key individuals within CEPA have provided some answers to those concerns. And we're currently awaiting response back from the committee to determine what other areas need to be addressed and what the timeline looks like to potentially be a part of this committee. Now, I want to be realistic that this is not a process that will likely happen over the course of a couple of months. This is an extensive process. So we will certainly be providing updates over the course of this effort. In addition to being a part of the committee, other strategies that the task force as well as the subcommittees that are a part of the task force and CEPA have been working towards educating and collecting evidence about various tasks that CEPs do and the benefits of those respective services. One area is looking at the QHP construct, so trying to describe the unique qualifications to deliver safe and effective exercise programs in healthcare. Try to describe ICD-10 diagnostic codes and CPT codes specific to clinical exercise and who delivers these services. So right now, the main emphasis is trying to identify whether or not these already exist, and if we can adopt these into future services that would be reimbursed. Or do we need to identify new CPT codes, identify new ICD-10 codes to be able to treat the patients that have been demonstrated to benefit from working with clinical exercise physiologists? Additionally, we have a big focus on occupational research. So research effectiveness of exercise programs, prevalence of CEP programs, and quantify the impact on healthcare. Now, this is one of the areas that I think as clinical exercise physiologists, as professionals and academics, we have taken for granted. We know that exercise is effective. We know that it helps improve quality of life, physiologic outcomes. It extends the number of good years that a person has in their lives. But unfortunately, there's not a wealth of data that is empirically demonstrating this. Similar to what I discussed in the beginning, clinical exercise physiologists work in settings such as cardiac rehab, pulmonary rehab, where you have other professionals delivering that service. So it becomes very difficult to really tease out what the CEP is contributing to that. And so this is an area where I'll discuss in a subsequent slide about how we propose to make this information available. As I mentioned, Clinical Exercise Physiology Association is hard at work with these efforts and have contributed a number of great resources this past year towards these efforts. One of which related to the recognition of the clinical exercise physiologist. We were fortunate enough to work with a medical illustrator from the University of Illinois at Chicago to develop an infographic that helps describe the roles and responsibilities of the CEP. This is something that I'm regularly faced with our patients, with physicians that I'm meeting with for the first time, and even just friends and family members, just trying to describe what a clinical exercise physiologist is. We find that having these incredible visual representations of what we do can hopefully help start that conversation and solidify what we do as a profession. This is available on our website for free, and I encourage everyone to use the link that's in the description of this clip to go there, download it, utilize it in your PowerPoint presentations for classes, for conference presentations, and just conversations with other QHPs within your healthcare setting to really start advocating for CEPs and help define what we do and who we are to those other individuals within the healthcare system. Related to this, another great task that we've been asked to be a part of is the Million Hearts Initiative, and specifically the Cardiac Rehabilitation Change Packet. Now, this is a packet that presents a listing of process improvements that cardiac rehab programs can implement to strive for optimal cardiac rehab utilization. So this is available nationally, internationally for cardiac rehab programs that are looking to elevate their offerings. And fortunately, many individuals are interested in these types of packets. And this is composed of change concepts, change ideas, tools, and resources to facilitate these efforts. And so there's a great opportunity for us here to be recognized as an organization, as well as a profession. Resources that will help advocate for the hiring of clinical exercise physiologists, educate them on what we do. And another great element of being involved with this organization is having readily available access to larger organizations like ACPR and the CDC to really help, again, increase the recognition of clinical exercise physiologists. Additionally, there have been many successful professional advocacy and advancement contributions this year. This is a white paper that was developed by Matt Thomas that is reviewing compensation strategies for the clinical exercise physiologist. This is essentially a paper that outlines how Matt himself went through this process at his organization and was able to advocate for a higher salary for his CEPs. The major elements within this document are going to be focusing on the alignment of position titles. So as Laura alluded to earlier when talking about post-nominal information, There are many different terms that have been used to identify a clinical exercise physiologist. In Matt's review of his system within his state, there was roughly 20 different titles that were used for the same exact position for a clinical exercise physiologist. Number two, the job descriptions and content that should be included at these organizations and services. Number three, consensus on certification. What would be a minimum certification necessary to practice and be recognized as a clinical exercise physiologist and require a higher salary? And then lastly, the implementation of career ladders. What does the process look like for individuals who are working within a program as a clinical exercise physiologist, and how are they going to be recognized as practicing at a higher level, having more skill sets, and being worthy of a higher compensation? So this document is intended to be used as reference for advocating for clinical exercise physiologists and is free for all to access on our website. And again, we'll provide a link to this so that you can start implementing this within your institutions. And lastly, with this effort of trying to identify what clinical exercise physiologists do, the CEP has created writing teams to be able to focus on programs across the US that have hired a majority of clinical exercise physiologists to run those services. Right now, Clinton Bonner led the effort to develop the cardiac rehab paper that is reviewing CEP practice patterns within that service line, and is being reviewed in the clinical journal of Clinical Exercise Physiology, so it should hopefully be available next year. Our intent is to do a similar effort with looking at pulmonary rehab, oncology rehab, bariatric exercise, because unfortunately, these are, again, services that multiple different QHPs can provide, and oftentimes clinical exercise physiologists are not readily identified amongst other QHPs. Having these documents available are not only going to be effective in helping us advocate when we go to the AMA, but when we go to legislators and trying to point to documents that really delineate and outline what we do as a profession and the services that we provide and the benefits associated with those services. In line with education, we're very excited about our 5th annual virtual conference this year, which is going to be held on February 11th. There are a number of different strategies that we've taken this year to make it truly unique from previous conferences. We have 5 highlighted keynote speakers, which I'm sure everyone on this call can recognize. Barry Braun, who will be talking about type 2 diabetes, Barry Franklin talking about strategies on how to be successful personally and professionally. Robert Model is going to be talking about multiple sclerosis and how exercise is imperative within the treatment of that condition. Mark Fahy is going to be talking about exercise and long COVID. And then Karen Wonders is going to be highlighting how exercise is utilized in cancer treatment and recovery. In addition to these wonderful speakers, we have also opened up applications to other live speakers. So we will have additional speakers on this day, in addition to virtual abstracts and poster presentations that will be highlighted on our website. And in addition to those early career investigators, there will be a competition to be identified as the early investigator of the year and have a $250 prize associated with that. So if you haven't already, I encourage you to register for this conference, which will be held February 11th. CEPA offers a number of webinars across with each year, as Laura highlighted, but one area that we would like to expand upon are additional educational resources for individuals that have the ACSM-CEP and are looking to specialize across different areas where exercise has been demonstrated to be effective in various chronic health conditions. For example, if an individual wanted to increase their professional development and specialization, we plan on having opportunities to have educational modules with exercise in diabetes, exercise in bariatric programs, cancer rehab, as well as working with individuals with neurological disorders. Another area that we hope to expand into is having resources that will help prepare individuals to sit for various certificates and certifications. One thing that is likely not commonly known is that many individuals or individuals who have a CEP and have accumulated the necessary hours can sit for the Diabetes Care and Education Specialist exam to become a certified individual and provide diabetes care and education. Additionally, ACSM provides a number of different certificates that individuals can prepare for. So we really hope to increase the volume of educational resources available to not only CEPA members, but also our partners in Canada, the UK, Australia, in addition to any other allied healthcare professional that regularly finds themselves in the service lines that we are finding ourselves in right now, such as nurses in cardiac rehab, pulmonary rehab. So great opportunities for us to be able to expand those CMEs and have this accessible to a large number of individuals across the world. Lastly, what I'd like to focus on is our CEPA registry. Now, we have very exciting news to share. So with these professionalization efforts and our alignment with strategies to try and increase recognition for the CEP, we have decided to provide a higher level of recognition for individuals who are a part of CEPA and who have been active in the field. So originally, the CEPA registry was designed to recognize those individuals that sat and passed the ACSM-RCEP exam. Individuals are now able to apply to be a part of this registry if they have the ACSM-CEP and have been practicing within the field. So this is an application process. So one of the limitations is that there are a number of CEPs that aren't housed within this registry. And so it's not as effective as working as your clinical registry, similar to other organizations, and specifically what we're accomplishing with US reps, which is housing every single individual who has passed the ACSM-CEP exam and is automatically housed within that registry. So to make sure that we are eliminating any confusion related to this registry, CEPA registry, and US reps, we've decided that we would be evolving this registry into a fellowship program available to members of CEPA. For that purpose, we are currently pausing CEPA registry applications. And once we have the applications that are set for the fellowship program, we will reopen applications specifically for the fellowship and effectively do away with the formal CEPA registry. The fellowship itself, the main purpose is to recognize those CEPA members who have helped advance the organization and or the field of clinical exercise physiology. We're still working on the details of the application, so the potential requirements will be related to membership, whether you'd have to be an active member for 2 or 3 years consistently to be able to apply for this, having demonstrated large contributions either in academic or scholarly activity, or contributions to the organization of CEPA, and or contributions to the profession itself. We will have different tiers that individuals will be able to apply and demonstrate their effectiveness within the profession of clinical exercise physiology. It will go through a committee that will review these applications and award fellow status to those CEPA members biannually. And one of the benefits to this is that there will be additional perks that are associated with having fellowship status, but also you would be able to put this behind your name to really demonstrate that you are someone who has meaningfully and significantly contributed to the clinical exercise physiology field. So more to come with this as our group is actively working on the finer details, and hope to have this available in this next year. One of the requirements, of course, is to be an active member of CEPA. So if you aren't a member yet, please go ahead and scan this QR code or go to our website to become a member. to start to accumulate the years that will be necessary to apply for the fellowship program, which we, of course, will identify in the coming future, in the near future. Finally, we want your feedback. So after watching this recorded town hall, we want you to ask us any types of questions that you might have about current professionalization efforts or activities within CEPA, and provide any comments that are related to what was reviewed today. Additionally, because we're looking to expand our educational services and opportunities to grow your skills as a professional, we're curious about areas that you want to improve on to make sure that we are able to facilitate these educational resources to the topic areas of most interest. We will have an online survey that's going to be available that will ask you to identify areas such as diabetes care, oncology rehab, obesity, weight management, neuromuscular disorders, post-COVID, cardiac rehab, pulmonary rehab, and then an opportunity to fill in any other topic that you are looking to improve your knowledge and skills in. Both the questions and comments, as well as your feedback related to educational offerings, will be requested, or you can go through this QR code to be able to fill out our Qualtrics survey, or you can email me directly about specific questions and comments that you want addressed at the next live town hall, which is going to take place on January 19th at 7 p.m. Eastern. All right. Well, there's certainly a lot of great things happening with CEPA as well as the ACSM Reimbursement Task Force. We only touched on probably the surface of things, and we're looking forward to this live town hall that will take place in January to interact with you, answer some of the questions that you have that you will submit either email to me or through the Qualtrics survey, and even have an opportunity to ask questions live during that town hall. Again, thank you for your attention, and really looking forward to interacting January 19th.
Thanks so much, Cemal. As we wrap up here, I'm excited to see the registration for the conference beginning to fuel as we near the end of the year, with the conference offering 5 CEUs, and I'm very excited to share the MPI. So just remember to kind of go down through those links that we've included below, work through the material, and we will wrap up again and meet in January to answer questions and get everyone on board. So thanks so much, Cemal.
Thank you, everyone. Talk to you soon.